13 News Now is your back-to-school station. New at 6, the last few years have been rough during the pandemic.
Yeah, with schools set to open again soon, you may notice your child is falling behind. Nicole Livis spoke with a local pediatrician about children in the COVID generation and how everyone can help get them back on track.
The COVID restrictions, protocol, and rapid changes from in-person to virtual have left all of us in a state of confusion over the past 2 years.
It's going to show huge discrepancies between those that have resources and those that have fewer resources available.
Dr. Douglas Mitchell is medical director and a pediatrician with Children's Hospital of the King's Daughters in Norfolk. He says that constant pandemic shifting has left quite a mark on our kids' development. One big challenge with preschool-age children, language and communication skills, especially with little ones whose schools shut down for a long time.
Whether that's because parents now have them at home, but parents are needing to work from home. And so they're giving the kids screen to keep them occupied while they're trying to work at the same time. That's not the same sort of interaction to develop language.
Add in any parental stress during that time, Dr. Mitchell says that also created a developmental issue for the children.
It's another one of the childhood traumas that adds to mental health issues and delays in development as well by how stressed, because if they're stressed, they're going to interact less.
So how do you know if your child is falling behind? Dr. Mitchell says your pediatrician can do an assessment during a well-child visit.
Keep up the routine well-child visits so we can identify developmental delays early and try and gain resources that they may need. Get the kids immunized with all the routine vaccines as well as flu and COVID. So that we can do everything we can to keep them in school this coming year.
And as you work with your child to get on track this school year, Dr. Mitchell says don't overthink the parental support and guidance.
You just remember the principles of childhood development. That's giving them free play, giving them conversation to do those things. Then you're already providing the most important therapy that a child can have.
Nicole Livis, 13 News Now.
Dr. Mitchell says he's seen a greater impact on mental health stemming from the pandemic in older children. CHKD may be able to help, though. It renovated 2 units in its main hospital to increase capacity.
A new building with inpatient psychiatric units and outpatient mental health care access is also set to open later this year. You can find more resources in this story on 13newsnow.com.